Greetings, everyone. Thank you for joining us this evening. What's this? Happy Tuesday. We are excited to be here. We are excited for you all to be here. And we were thinking maybe go ahead and get started. We have a few more people we're waiting on, but we'll go ahead and get started. So as you all know, we are here at the Black Maternal Health Week Roundtable. And today joining you all on the roundtable will be myself, Mama Yada, and the beautiful Danielle Ivory.
Hi, everybody.
Yes, so we are going to get started. Again, my name is Mama Yada, and I am the founder of Melanin Mothers Meet. Melanin Mothers Meet is a nonprofit organization started back in 2016. And we were excited to get started through confidence and just the idea of knowing that Black mothers needed a lot more help than we were getting. So I wanted to go ahead and bring the community that was interested together to get something like that up and running because it was needed. A lot of Black moms were dying, a lot of Black babies were dying, and a lot of moms were facing postpartum depression at high rates. So we decided to go ahead and get some programs together where we had workshops and seminars for moms and for families who needed guidance on the tools or resources necessary for a successful pregnancy, labor, and delivery, for a successful postpartum period. And so a lot of women from the community has really put a lot of work into Melanin Mothers Meet. And I am so thankful for them. So we'll speak more on Melanin Mothers Meet afterwards. But if you were interested in knowing more about it, the website is www.melaninmothersmeet.com. So thank you all so much. And then Danielle, I know that you are a part, as well as myself, actually. I'm very happy to be Capital Healthy Start. And I'm so excited to finally be collaborating because we've been talking about this, right, Chris, for a while. And, it's just really important for us to know that there are resources out here that are specifically for Black mothers. And it's not, it's just really not a thing. It's really not a thing. There are a lot of racial disparities that are going on, right next to us. And a lot of times people are not speaking out about them. And this is a roundtable for us to speak out. And we have to be able to connect on levels where, our differences, just kind of move those to the side and focus on what the cause is and what we're really here for. So I just wanted to appreciate you all for coming into the roundtable. And like I said, if you want to know more information about Melanin Mothers Meet, you can find us at www.melaninmothersmeet.com. So today at our roundtable, we have a few questions that we wanted to start with. But before we did that, I definitely would like to know more from Danielle. If you wanted to go ahead and introduce yourself, you're welcome to.
Okay. Hi, everybody. My name is Danielle Ivory, and I'm the Sister Friends Program / the Special Projects Coordinator at the Capital Area Healthy Start. And I'll be joining Mama Yada tonight with the roundtable discussion. Do you want me to go ahead and talk a little bit about Healthy Start, Mama Yada?
Yes, please let the people know.
Okay, so I want to provide you guys with a little background on Healthy Start and our coalition. Healthy Start is a statewide initiative that was created by Governor Childs in 1991. The legislation established prenatal and infant health coalitions across the state to create public-private partnerships that will provide a system of care to reduce infant mortality and low birth weight babies. Governor Childs recognized that biological, environmental, economic, social, and psychosocial factors influence pregnancy and health outcomes. We have a few different programs over at Healthy Start, and our programs include our coordinated intake and referral program, which is our Connect program, our Healthy Start home visiting program, and also our fetal and infant mortality review program. Our newest initiative is our Sister Friends Tallahassee Birthing Project. We're going to dive into the Sister Friends Tallahassee Birthing Project in just a few minutes. So first of all, I want to talk about the racial disparities in birth outcomes. In Leon and Wakulla counties, Black babies are dying at a rate that is more than twice that of white babies. This number is only slightly lower than the state rate. Local moms face barriers to accessing quality prenatal care, environmental stress that can put their babies at a higher risk of being born too small or too soon. We have been working on the racial disparity gap in our counties for several years, and we haven't been able to close that gap. As a community, we challenge ourselves to find new ways to address these disparities. So in 2020, the coalition completed a needs assessment, which showed 3 key priority areas. The first was access to care, racial disparities in health outcomes, maternal mental health, and substance exposed newborns. The coalition created a service delivery plan with help of community partners that includes goals, objectives, and an action plan to create change in our community. The coalition also formed a partnership alliance to carry out the work in the service delivery plan. The alliance consists of 3 work groups: access to care work group, racial disparities in health outcomes work group, and a maternal mental and substance exposed newborns work groups. These work groups meet the first 2 months of each quarter. In the 3rd month of the quarter, the work groups come together for a full alliance meeting to share progress made on the action steps. The coalition is currently looking for members interested in joining these work groups. If you are interested, you can please reach out to our executive director, Chris Sorchik, and her email is chris@capitalareahealthystart.org. So back to talking about the racial disparities in birth outcomes, what the data tells us. Through the Fetal and Infant Mortality Review Project, in which we review cases of infant and fetal deaths in our community, we found that women lack prenatal and postpartum care. They're not following up with referrals by their providers, and they lack family planning, and babies are not in a safe sleep environment. In Leon County, Black women are almost twice as likely to deliver a preterm baby. Black women are also as likely to deliver low birth weight babies. And some of our services at Healthy Start includes general support and community referrals, pregnancy health education, nutrition education, childbirth prep, new baby care, parenting education, and breastfeeding education and support. So now I'm gonna dive into the Sister Friends Tallahassee Birthing Project. This is our newest initiative, the Sister Friends Tallahassee Birthing Project, and it's an affiliate of the Birthing Project USA. So you guys are probably wondering, what is the Birthing Project USA? So the Birthing Project USA was founded in 1988 by Catherine Hall Trulio in Sacramento, California. It was to reduce infant mortality and morbidity in African American communities. It's a method of improving birth outcomes and a national movement to educate and invite community people to become involved in saving lives. The project is based on the premise that communities have the strength and ability to grow healthy babies. It encourages defining the role of its role in the community and the family. The concept of the community sister friends rests on the foundations of each one teach one and the extended family. So our goal for the Birthing Project, the goal is to increase knowledge of African American mothers regarding the importance of having a healthy pregnancy and healthy baby while helping to produce healthy community outcomes. So now I'm going to touch bases on the Sister Friends Tallahassee Birthing Project. So I want to talk about the sister friends. I want to talk about the little sister. I want to talk about like the outreach and the community that we do for the sister friends. So first of all, who are sister friends? Sister friends are volunteers who support pregnant moms. She does not have to have a background or experience in healthcare or parenting. She does need to have good communication skills, including the ability to listen and the time to spend in the sister friend relationship. The sister friend is compassionate, supportive, reliable, trustworthy, and she becomes an extended family member to her little sister. We gain sister friends through outreach via social media, attending community events, and visiting local beauty salons on a regular basis. Our sister friends are responsible for connecting with their little sisters, sometimes weekly, providing emotional support, mental health check-ins, helping her to overcome barriers to her care, and connecting her to community resources in order to support her and the health of her baby. So the little sister, what do you have to do to become a little sister in the program? To be eligible for the little sister enrollment in the Sister Friends program, the participant must be an African American expected mother who is a Tallahassee resident. And that's pretty much it for the Sister Friends program and the overview of Capital Area Healthy Start.
Yay, sis, that was beautiful.
Okay. Yeah, Mama Yada, I didn't want to be too long-winded.
No, because
Okay.
that knowledge is needed. A lot of people don't know about these organizations and these resources that are here. So it's good to get the fulfillment of really what it is, because a lot of times you may see a flyer, you may hear about it, but you don't necessarily get to hear the backstory and what you just gave us. So that is really good. I really appreciate that. We're going to go ahead and get started into, oh yes, perfect. Hi, Dr. Amandala. Dr. Amandala, hi, how are you?
Greetings, I'm good. Good to see y'all beautiful people. Hey, Danielle.
Yes, this is the founder of, yes, that's the founder. That is the founder, Dr. Amandala.
I didn't know she was on here because I wanted to recognize her as well.
Oh, thank you. Sorry, guys, I'm on my phone, so.
Oh, you're fine.
My video is like, ooh, I'm on my couch.
Yay. Yes,
I'm not the founder of Sister Friends, but definitely a longtime advocate of the National Birthing Project USA. I was a little sister at one point in my life, so I understand the role of having a sister friend and having that kind of partner to just walk you through whatever your circumstances are, in pregnancy and postpartum. So it's a very powerful program. Thank you, Danielle, for presenting that, and, Healthy Start for taking up this initiative and putting it in the community. I'm an advocate for this, so I'm happy, Melanin Moms is here to disseminate this information in the community. Thank you.
Yes, thank you so much, sis. I really appreciate it. And if you weren't the founder, you still recognized it here and you brought it to life. So we appreciate you for that as well. Also, we're going to go ahead and get started with our questions. Our first question that Danielle and I are going to kind of piggyback off each other with is what kind of mother, or excuse me, that's the next question. Why is it crucial for us to recognize Black Maternal Health Week? Why is it crucial for us to recognize Black Maternal Health Week? Daya, did you want to get started with that? You want me to get it? What you want to do?
You can go ahead and start, Mama Yada.
Okay. All right, so I'll go ahead. So the question again is, why is it crucial for us to recognize Black Maternal Health Week? And there's so many factors in that question. I would call that question actually a loaded question because you can tackle it in so many different ways. What I'm going to tackle first is what one of my great members, Melanie Williams, always speaks on, is advocacy and policy. And without that, you really aren't going to be able to get a change because it starts with that. And the more Melanie is teaching me and the more that I'm learning and doing my research, it has to go to that level. It has to. It's just the inevitable. And the advocacy and policy has to reflect the success in our pregnancy, our labors, and delivery. And so something that we offer with Melanin Mothers Meet when it comes to that is we offer a task force for Black women who are in postpartum periods. And they may need someone to cook or to clean or to care for other children. We will offer that. Usually mom would, do a consultation, and we'll kind of just assess to see what it is that she needs. And then we will put together a task force, and we will send out moms to either grab something to eat for this mom, maybe to fold up some clothes for her because she might need help with laundry. She may go over and bring grocery and cook for her, if the mother is comfortable with that. A lot of these things, and I have to remind everyone that these things you don't need a certification to wash clothes. You don't need certification to bring grocery. These are things that, Norma down the street can come and do if she knew that it was needed for her. You know what I mean? So these are things that we have been doing, and we hadn't really gotten a lot of, we weren't really looking for recognition in it. It was just kind of, okay, this is what we need, so this is what we're going to do. And obviously it's one of those things where if a mom just had a baby and a mom needs that help, because she's tired, she just had maybe one or two children, who knows how many children she had, but she doesn't have the energy that she needs to even think sometimes. So having an advocate around her or advocates around her at that time would be crucial for her not to get into that postpartum depression. And that's what we want to avoid. We want to avoid all of the disparities that may come across. So we at Melanin Mothers Meet find the solutions to help our mothers, get around that. So one of the ways that we help with decreasing the postpartum depression is making sure that our moms' needs are met immediately. You need some food, here you go. You need a babysitter for your other children, here you go. You need me to hold the infant while you go shower, here you go. You need me to hold the infant while you just do nothing. So it's available. And what I've noticed, a lot of times is, and this would go into another question that we have, which we're talking about the different issues and barriers that stand in the way of Black moms. And I would say, along with a few others, I won't get too deep into that question because I know we're on another question, but one of those things is letting go and allowing the help. You have to allow the help. And I understand it's discernment, and you have to make sure that, who you're allowing in your house and, all the things that go with that. But at the end of the day, you just had a baby. You know what I mean? And those are very important moments and very crucial times to make sure that your alertness is high, and making sure you understand who is coming in your home. But that's why you build relationships and you build that rapport and you speak to these people throughout, you know what I mean? Because that's what community is. And we have to start with ourselves, because our children are looking at us to see how to build relationships with people one day. So that's what I wanted to say with that question. Go ahead, Danielle.
Okay. Well, I also wanted to talk about why is it crucial for us to recognize Black Maternal Health Week. I think it's crucial as well for us to recognize Black Maternal Health Week so that we can help mothers, young Black African-American mothers, understand the challenge that they face because of lack of resources. Maybe they don't understand, maybe they don't know about unhealthy pregnancies. Maybe they don't know that Black women are 2 times as likely to experience unhealthy pregnancies other than our white counterparts. A lot of people in the community, pregnant moms, if they're younger, they're not educated on that. They don't have the resources. They may not even have that family support. They may have a certain type of family support, but they may not have that type of family support that they actually need in the household.
Awesome. That is a great point. And, that support is needed for sure. So, just even knowing that you have a service like Capital Healthy Start, you have a service like Melanin Mothers Meet, versus not knowing that, it can make a big difference in the success of your pregnancy, your labor, your delivery, your postpartum period. And then, with the birth of Sister Friends Project, I mean, you really can't go wrong. So it's just one of those things like, hey, you have resources, you need to use them. And then we have to do a better job of, coming at a round table like this. This room should be filled with hundreds of Black women that are on this same protocol to say, hey, the death rates are way too high for us not to take this serious. You know what I mean? And I also understand that, our ancestors, our grandmothers, they worked too hard to, for this to be the result. You know what I mean? We have to do better. We have to do better. And so it's not going to just take, one side, or we can't, point the finger, but we definitely want to make sure that we are, just coming together to help out in any way that we can. And these resources that are provided for us in the Leon County area, it's the way to go. It's definitely the way to go. So, okay. And that was all for you for that question, Danielle?
Yes, that's pretty much it. And I also want to just note that, even, and also it's sad to say, but some African-American mothers in the community don't know the death rate. They don't know anything about the infant mortality rate because they're not educated on that. And like you say, we as community leaders, we need to get out a little bit more and advocate for like Black Maternal Health Week more in the community. Like you said, we need more people. We need more moms. We need more teams a part of these roundtable discussions.
Yes, I can't agree more, Danielle, and I appreciate you for taking time out of your evening, because as I know everyone here, thank you all so much for being here, because everybody has something to do at all times. So it's good to know that you all are taking this very serious and supporting organizations that are here to lead and to fight for Black maternal health. So I wanted to go ahead and move on to the next question, which is what issues or barriers stand in the way of Black women having safe, successful pregnancies, laboring, deliveries, and postpartum care? You want to go ahead, Danielle?
Yes, I can go ahead with that. First of all, like we said in our needs assessment, transportation as well. Transportation is a barrier. Access to care, the racial disparities, all of that is a barrier. And also another barrier is a lack of resources, a lack of nutrition.
Yes, that is so true. That is so true, especially with nutrition and then lack of resources. I mean, it's all so important, and the list really can go on and on and on. But those points are really good to be able to point out and to find a solution for them. And that's something that Capital Healthy Start offers. So that's really good to know, as well as Sister Friends. Oh man, I love the fact that you all are connected the way you are, because it's magic. It's magic. I'm not going to go too far into that. But I'm just very proud of that. I'm very proud of that. And I'm also proud to be a part of that. But yeah, so the issues and the barriers that stand in the way of Black women having safe, successful pregnancies, labors, and deliveries, postpartum care, I think a lot has to do with the confidence. I feel like a lot has to do with the confidence, because just like myself or anyone on this call, anyone else that wants to reach out and to find these resources and things, just how we've done, that can be done. You know what I mean? That can be done. But having that type of confidence when you're in despair, or when you're mentally challenged by the society and different things that are thrown at you in your life, and adversities, and if you're going through all of these things and you don't even know that Sheila two doors down, maybe going through the same exact thing that you're going through. But then we need someone to connect you to, because you're not going down to Sheila's house and Sheila not coming to your house. So we need somebody that's going to say, I know it's more than just myself or the next person that's going through this. Let's do some call to action and see what can be done as a community, as a group. Because it's not, the only thing that's going to continue to happen is what's already been happening if we're not connecting in that space. You know what I'm saying? So,
Right.
you know, and with Melanin Mothers Me, we offer different trainings to help with confidence. We offer different services to help with, you know, moms. For instance, we had a mom who was having a third child. And she was very down about having that child because she felt like she didn't really know what mothering would look like for her. And so what we did was we created an online meeting with her and other moms who had multiple children, so she could see it for herself. It's very important for us to be able to see people who look like us that are going through what we're going through and surviving with a smile on their face, maybe sometimes, maybe not, but still getting it, making it happen. You know what I mean? Making it happen, doing what's needed so that we can say, hey, you know what? Here's an adversity. Hi, adversity. I see you, but I'm gonna knock you out. You know what I mean? I'm gonna push you to the side because these are my children. I have to raise them. And so with her being able to see these moms and ask them questions, you know, she didn't know all of these moms, but what they had in common was they were Black and they had children. They have Black children. So we got something there. You know, we have something there. So it was good for her to see that. And that just allowed me to see how easy it can be. You know what I mean? With the amount of resources and accesses, like you all said, we need that. We have to do more of these. We have to be more involved in the community. So it's not just those who are organizing online. There are those who need the help online as well. You know what I mean? So that's what I would say on that. Danya, do you have anything else for that?
Yeah, and I was going to talk about like the call to action. We need more people. We need more community members joining like these work groups that we have over at Capital Area Healthy Start. Not just community members, mothers as well, new moms, moms that have 2 and 3 babies. We need them to become a part of these work groups over at the Healthy Start.
Yes, and those work groups are really great. I really like the female work group as I'm coming back into myself and being more involved in different programs that we have and work groups that are offered at the Capital Healthy Start level. So I really appreciate you all for putting that together. As always, I am always excited to speak about the organizations that are here to support Black moms and to help us to get where we need to in whatever capacity that they can. So we're gonna go ahead and take off to the next question. And that question is, we're number 3 and we're doing good. The question is, what does your day to day look like? And how does that tie into your advocacy for Black moms? And that is a very good question because, you know, oftentimes, well, first of all, you have to be very, what is the word that I want to use? You have to be very aware of what you're doing if you're not a Black mom that ties into the advocacy for Black moms. So being a Black mom, you know, it can often also go into autopilot where you're just kind of going with the flow, moving day to day, not really doing things intentionally. That's the word I was looking for. Not really, you know, doing things intentionally. And you're just really trying to survive. And I can imagine, I only have 2 children, but I can imagine those with more than 2, you know, and even 2 or under. It's one of those things where balance is needed. You know, you need to have a balance. You need to be able to enroll your children, or make sure your children are enrolled in school, make sure you're going to work, everything, and making sure you're cooking at home. It's just everything that you have to balance. And so, when we ask the question, what does it look like? For me, I'm thankful to be able to be in a position where I'm working in an area where all I do is for Black moms. And then, as well as my children, one is 6 and one is 2, just kind of involving myself intentionally in their lives and the things that they're doing. And I often find myself, because I have a son and he's 2, and then my daughter is 6. When I had my daughter, I was super confident. I was like, yeah, I'm a girl, I'm a woman, I can teach her everything I know. Woo, girl power. And then I had a son, and I was like, hey, nobody told me about this part. I didn't know about this part. It was a little bit more challenging. My confidence kind of, it didn't never waver, but it was just like, all right, I don't know, we've never seen this before. So it was harder to kind of find ways to, just make sure that, okay, I want to give him the same attention that I'm giving her in that form, as if I already knew, what was happening, because obviously he is a Black male, I am a Black woman. So we didn't connect a lot, and we're still learning how to connect. But, just to be honest, my son has been my biggest challenge. And I think that also had a lot to do with, and here's a little bit of my personal story, but that also had a lot to do with my advocacy when it came to my son, because I really was having a hard time with him. And I finally let go, and I finally put myself in a space where I was like, you know what, this child was given to me, so obviously I know what to do with him. And it was just, once I changed my my narrative, on his story and how he got here, and the connection that we were going to make and create, because I'm like, well, I'm a confident mother, I know how the kind of mother that I want to be. And my son was a challenge for me, and I don't really speak much about my challenges. I'm very private, so I don't really speak about a lot of my challenges, but, having those challenges, led me to using the tools and the resources and the programs that I put together for other mothers. So, it's kind of one of those things where, as we all are, we're speaking to an audience, but we're also speaking to ourselves, because we're human. We have things that we're going through and challenges that we face with our children as well. And the ways that we get through them are needing to be shared, so that other mothers can say, oh, I had a similar experience. Oh, that's how you got through that adversity. Let me try that way. You know what I mean? And that's just really important to get to those solutions, and to, be intentional about your day-to-day when it comes to mothering and, advocacy towards Black mothers. And you want to go ahead, Danielle.
Yeah. So I was going to talk about my day-to-day and like my work role, as the Sister Friends program coordinator. So what does my day-to-day look like? My day-to-day looks like connecting with the community, going out in the community, doing outreach, talking about the services that we offer at Healthy Start, trying to recruit new sister friends. I'm talking with African American mothers at the local beauty salons. I'm going to like some of the pregnancy testing centers. Not only am I talking with African American mothers, I'm also talking with white women in the community that's also community advocates. I'm talking to them about the Sister Friends program, also teaching them ways how they can be a part of this new initiative, letting them know that they can still talk to a young Black mother, they can still talk to a young Black mom about the services that we provide at Healthy Start. So I'm educating them on the services as well, educating them on the Sister Friends program that they can help us better, talking to them about the work group so that we can get the community as a whole as a part of everything in the community, everything that we have at Capital Area Healthy Start, everything that we're doing in the community for African American mothers as well. But my day-to-day is pretty much outreach, networking.
Thank you, Nayel. Oh, go ahead.
No, I was telling you he was on mute.
Oh, okay. Thank you. Yeah, that'll happen sometimes. We all love a good Zoom call. But anyway, yeah, so I wanted to go ahead and say that for sure is connected to, day-to-day mothering, and everybody, like Melanie said here, it looks different for everyone. So I wanted to go ahead and open the floor. I know we were going to speak on a few more things. First, we'll open the floor to this question to see who wanted to go ahead and answer that or start us off on that. And that is, what kind of mother do you see yourself as, or do you want to be? And when I say that, I mean, as a mother and maybe a sister friend looking at you to say, man, she's a really good mother, or, whatever that looks like. What does that look like to you? And even, and not to say that, you have to do everything right, but, defining good mother for me is the children are the best quality of life, healthy, alive, cared for, and loved. And those things look different in every household. So being able to see that and identify with that is really important. So anyone wanted to speak on it first? Don't all go at the same time. All right, I'm gonna start calling out names. Let's see.
Okay. I'll go. Okay. Let me take off mine. Okay. So I guess that's a really good question. And I didn't really think about that until till I was pregnant. I always knew I wanted to breastfeed. So having worked with, in my field as a nutritionist at WIC, I knew that I would love to be successful at it and inspire other people. But I think for me, now that I'm 8 years into motherhood, I think that I would want someone to see me and feel like they see intentionality with me. And I use that word a lot. I feel like people, especially parents, should make every attempt they can to make their parenthood or their motherhood their own. I think it's really important, and you set the standard of what that's supposed to look like. And I think this is a good space, and I hear everyone saying, hey, it's going to look different for everybody. I do try to get people to think about not backing into motherhood, but walking towards it. And I have a better understanding of what backing into it is, because they're just reacting all the time. And you can't control everything. I mean, my first foray into motherhood was literally, oh, my kid is here and I'm not even 6 months pregnant. So I definitely know how things can just happen. But I do think it's important to have your eyes wide open and think about your motherhood even before you become a mother. I do try to let people know that, try not to think of motherhood as some nebulous endpoint that, oh, one day it's going to happen. I do think you should think about that well ahead of actually before you conceive your child. So then, and half of childbirth is unplanned, not necessarily unwanted. So I think when you do conceive, whether it was planned or not, you still have a good idea of what you want. So I would hope someone sees me and, understands once they get to know me that I was very intentional, not that I had control and things didn't, just kind of happen, but I was very, very intentional about my motherhood. And for the most part, not completely, it happened the way that I desire. And I do want that for everyone. I want people to think about their motherhood and do it the way they want. If you're a career person like I am, but still very hands-on, that's good. That's what you want. If you do not want to be a career person, you want to be a stay-at-home parent, I respect that too. But I think people should think about that. I even talk to mothers who are like, I want to breastfeed and I want to bottle feed. And I say, good, let's set a goal for that. Because some people don't want to just do breasts all the time. They want to do bottles. That's fine. At least you know. And I have so much respect for people who say, I want this. And I say, let me help you with a plan to walk you to that point versus, well, I don't know what I want to do. That does not serve children. That doesn't serve the village. So that's what I think intentionality is so important in thinking about it, because birth and childbearing is so important. It's so serious. And when you have a little bit of a plan or an idea of what you need and what you want, when things do go kind of west or left, you can kind of pull back on that path and say, okay, I had this kid super, super, super early, but I know I need to breastfeed. I need to, just kind of circle back, and at least I can do that, even though this child came, incredibly early. So I just want to put that out there.
I can answer the question because Daikira was hitting on some points, and I'm sorry y'all for my voice. I'm getting over a cold because I have 3 kids. When it's usually one gets sick first, and then me, and then the other 2, and then my husband goes last. So right now I'm in the thick of it. But I think you said some things that really resonated with me. I didn't plan my pregnancies, but way before I had kids, I always wanted to have kids, and I always kind of just assumed that I would. I grew up with 2 brothers and 2 sisters, and my parents married, and you kind of just see that. And even if they don't tell you specifically, oh, this is going to be you, I think a lot of us kind of just assume that. So that was me. And I became an activist in 2012, and people would ask me like, why do you do this? And I would say, oh, one day I'm going to have Black children and a Black husband, and our lives matter, and we need to fight for a better world for them. So when I actually became pregnant the first time, that's when I had to kind of try to find resources and, Googling stuff and talking to people. That's when I actually met Mama Yada, and she told me about Melanin Mothers Meet. I don't think that I had time, or I don't think I even realized that I needed the time to think about what this was going to look like, not just from the day-to-day standpoint of living, and how are we going to plan our life? How are we going to, get from point A to point B? How are we going to answer the needs of our children? My oldest was diagnosed with, he's on the autism spectrum. And so, figuring out how to get him into school early so he can go into speech and occupational therapy. All of these things, there's not like a manual for it. And there's a lot of resources out there, but they're not organized, and they're not all in one place. And there are some schools of thought that you may not agree with. So you have to fish through all this stuff and learn as you go. I don't think I had put that into perspective. But when I was an activist back in the day, in the streets, protesting, marching and everything, people in my group used to call me Mama Mel. And my mom actually is the youngest of 10 children. And she said at a young age, she got her nickname is Xenia, but they used to call her Mama Xenia. And that just always stuck out to me. Like, wow, both of us, way before we actually, started giving birth, we had these nicknames. And the people in my activist group, they always told me that they called me that because I had that stern tone, I had that seriousness. Like, we would all get together and hang out and have fun, but I would be kind of the one to steer us back on track and say, hey, this is what we set out to do, so we got to do it. So they would call me Mama Mel because I was always the stern one. And when I think about motherhood, so many times I see like the conversation, like, on social media, on the web, is like, it's like a dichotomy. Like, you're either like this housewife making everything from scratch and, all the holistic remedies and everything, or you're, a career woman. And I've always wanted my kids to be healthy and to, I wanted to juice and make smoothies and those things, but I also have always wanted a career. And for the past 10 years, I've wanted to be an attorney. So I knew that somewhere in the midst of making fresh juices for my family, I have to actually be, writing 20-page briefs and stuff. So I've always known, like, I want to be a career person, but I still want to be super involved in my family. So when I think about motherhood and what type of mother I want to be, like, I want people to see what I'm doing and know that you know, the roles that I take in life don't define me. Like whatever it is that I was set here to do on this earth, I can do regardless of the responsibilities that, you know, I chose to fulfill. I think that seeing Judge Ketanji Brown Jackson to actually be nominated to the Supreme Court shows that, right? Like she has 2 kids. I cried when I saw that photo of her daughter sitting off to the side, looking at her mom smiling. I was like, you know, I think I want to get that blown up on a canvas because I'm like, I want my child to have that pride in me. Like when I look at her, that's the type of mother that I want to embody. I want to be able to raise my kids, show them that you can be anything you want to be, but I also want to have a huge impact on our community. I think Black Maternal Health Week is a start, you know, for us locally to be able to have that recognized, for us to get the word out about the coalition and these working groups and really start to educate our peers. You know, we don't have to wait for experts to come to us. We can talk about the numbers, we can look at data, and we can apply our stories to it and know that the truth we're living, it's studied and it's proven that, you know, our struggles are real and there's a reason for it. So for me, motherhood is activism. Yeah, the comment, Black mother is activism, literally. That's how I feel. So that's how I think of myself as a mother, you know. It's important. Like we literally have to advocate and fight for ours. So I'll leave it at that.
Wow, Mel, thank you so much for sharing that. Oh man, Mama Mel, it is written. So anybody else wanted to touch on that? Yes, definitely awesome. Definitely awesome talk, Mel. And also at Dikeeper as well. Anybody else wanted to go ahead before I start calling names? Hold on, I'm gonna be like teachers in the classroom now. Yeah, I know I'm gonna call y'all. Okay, who we got? Oh, Dr. Mandela. Hi. Is this a good time?
As I'm washing dishes in the background. Keep on multitasking here.
Look, I knew you were mothering somewhere doing something.
Yes, I'm mothering and trying to keep house and stuff.
Yes.
So let me just find what was the question?
The question was, what kind of mother do you want to be, or do you see yourself as? Were you able to hear what Melanie was saying? Kind of touching on that.
Yes, I did.
Okay.
The point, yeah.
Okay. Yep. So basically,
Okay.
yeah. What kind of mother you want to be, or what kind of mother you see yourself as?
Oh man, that's a good question. I think I'm gonna piggyback off the last thing Mel said. You know, being a Black mom is activism within itself. You know, I'm coming from a place where, you know, in my medical training, being overseas, you know, I was fortunate to experience, I guess, a society or a culture that had very high health literacy. And, you know, those patients did an excellent job of advocating for themselves. You know, anytime there was a need, they had the education to back it up. It wasn't formal, you know, like medical education, but the culture drove this kind of wherewithal to understand human conditionings and the pathology around that. It was crazy to me. Like I couldn't even fathom that a whole nation of people could be so above standard, you know, me coming from here in terms of what they understood about their own selves and their health. So, you know, from having that experience, I feel like it's a charge on me to, yes, Cuba, right, yes. I do feel like it's a charge on me coming back into the system as a healthcare professional, as a Black mother, to, you know, do my part to elevate our culture into more health literacy so that we can be more active advocates for ourselves and for our families. So I do that within my work. I try to be that example for my own daughter. And, you know, lately, lots of students have been coming to me for, I wouldn't even call it mentorship, but just for information. So yeah, my role as a Black mama is to keep momming. You know, before I was a mother, I was an auntie. So I was always looking out, you know, and trying to be that support system. So I'm going to keep that fire burning and continue to do what I do. And the importance of this week, as Melanie was saying, is to bring some visibility to the importance of paying attention to Black women and this perinatal period. You know, in my work in BH Impact, we use the statistic, you know, Black women are very disrespected. Bottom line, we're disrespected when it comes down to our healthcare and how we receive it. So we do not have to continue to be under that disrespect if we know what we need, you know, and if we can inform systems through these types of activities and working groups, then we're on the right track. So yes, great question.
Thank you so much, Dr. Mandela. And on
Absolutely.
the spot, get it. Thank you again, sis. Thank you all so much. Oh, your 2-year-old. Okay, peace to you, sis. That's Miss Taylor letting us know that she has to go take care of her 2-year-old. Thank you so much for joining us. And this is recorded, so hopefully we'll be able to give this to you if need be. Okay, and so I wanted to piggyback kind of off of what Dr. Mandela was speaking on, and it kind of triggered me into thinking about, you know, how our children view us, how they look at us, you know, on a day-to-day, how they see us facing our challenges and what we do about them, what type of solutions we use, how do we respond to life as it happens to us? You know, do they see us, you know, cursing everybody out? Or do they see us, you know, being really sweet and kind? Or do they see a balance? You know what I mean? So do they know when to respond this way or when to respond that way? You know, so it kind of reminded me of when I first had my daughter, before I even thought about a son. You know, and I was really heavily out with M3 in the community where we would do events and meetings every month. And I wanted my daughter to see early that, hey, this is what confidence looks like. You know what I mean? This is what it looks like to be able to say, I'm going to speak up for myself. Just like when Dakeeper was saying how, you know, knowing what you want is half the battle. Knowing what you want is half the battle. And so being able to speak up for yourself, being able to say, look, this is what it looks like and this is what it's not going to look like. And not having any hesitation about it and not feeling guilty because you want what you want, not feeling guilty because, you know, you're telling the doctor possibly, hey, I don't want you to cut the cord, you know, and they may try to auto suggest something in your brain to get you to say, hey, well, maybe you're right, or maybe I'll reconsider it. No, I don't want to cut the cord right now. I want to delay the cutting. And that's that on that, because this is my child that came from my loins. I should be able to speak up for what's coming from me. We don't even know you, sir, ma'am. You know what I mean? So it's just one of those things where, you know, you don't have to get, you know, in a typical conflict, but, you know, Black women are looked at as conflict just day to day, you know, so we cannot help that because we are assertive and we are confident and know what we want. And our sisters that, you know, may, you know, have not been, and I don't want to say lack confidence. I hate to say lack confidence, just not identified the confidence within them, because the confidence that I have, the confidence that Mama Mel has, the confidence that Dakeeper had, Dr. Mandela has, Chris, Danielle, the confidence that we all have, it's not something that, you know, somebody, you're not giving it, you already have it. You just have to be able to identify. You have to be able to know, you know, where to pull it from, you know, and culture and what the culture that I believe in, I pull a lot of my confidence from my ancestors. So I'm pulling confidence from my great grandmother. You know, my great grandmother did not play. Okay. So I'm going to call her name when I need to be in that mode. You know what I mean? And so it's just very important for you to be able to just kind of align and touch bases with all of those factors when it comes to, what it looks like, being a mom. And a lot of times we don't necessarily know what we want it to look like, because what we've seen might not have been what we want it to look like. So if what we've seen was not, an example of something that we were confident in, and, moving forward, as traditions usually are, we may see something in that tradition, or we see something, that our mothers did before that we may want to change, or, or to differ. And it doesn't have to bring, differences don't have to bring in, what's the word I'm looking for? I guess difficulty. You know what I mean? It doesn't have to be difficult. It can be something that we communicate, and something that, okay, well, this is what you like, this is what and it's really not hard to get along with people regardless of the differences, but you also have to be very clear and be very confident who you are, and sure and who you are, when you're around people that are different from you, and that's something that I think is pretty simple to get to. What are you thinking, Danielle?
You saw me tapping my pen, huh? You're on mute, Mama Yada.
Oh, no, I was speaking on, just basically the confidence and speaking up for yourself. And, just why the importance of it. Just kind of want you to piggyback off of me, if you didn't mind.
Oh, okay. Gotcha. So basically with me, like, how do I see myself as a mom? I see myself being, patient, humble mom. I have a 16-year-old. I was a teen mom. I was 19 when I was 19 when I got pregnant, had my daughter at 20 years old. So I want my daughter to see me in my advocacy role. I want her to understand, I want to give my daughter resources that I didn't have at her age. She goes out in the community with me. Some days when she's out of school, I take her out to do outreach in the community. So she know what it's like to help out in the community and to give back. Like, when I started my job over at the Capital Area Healthy Start, she wanted to know, well, what is the Sister Friends program? Why do we need this program just for, Black moms, African American moms? And I had to talk to her about the racism in the healthcare system. I had to let her know different things like that. Because she didn't understand. She didn't understand, well, why do you feel like Black moms get treated different in the healthcare system? So I had to teach her a lot of things that I even didn't know at her age. And she was excited to learn. She's interested. She loves what I'm doing over at Healthy Start. She's willing to go the extra mile with me. So she's doing the work along this journey with me as well. So, and like also what Melanie was saying with the lady, when her daughter looked up at her, like, I feel like that's how my daughter look up at me. And I want her to continue to watch me in a good, positive light. I don't want her to see me in a negative light. If my energy is ever negative, my daughter would never see it. And if my energy is never off, that means I got to work on myself, and I don't go around people. I just work on myself in that time. So I see myself as a mother that's full of self-care and, self-love, and also providing my daughter and just radiating positive energy into our communities and radiating positive energy into my household.
Yay, that's awesome, sis. Thank you so much for sharing that. Wow. And you said, how old was your daughter?
16.
16. Oh yeah. Oh, so she's ready. She boots on the ground ready. You can put her to work. Awesome. Okay.
And this is where that confidence comes in, Mama Yada. I mean, imagine I can remember being 16 and even younger, looking up at my mom, being the powerhouse that she is. Y'all know who she is. And thinking, and even, until recently, I wasn't always sure that I could measure up to my mother's confidence and to her power. But I've learned to harness that in a different way that works for me, so these lessons that you are providing to your daughter, Danielle, Mama Yada, they're watching and they're paying attention, and that will inspire them to be advocates in their own right. and to pay attention to the issues that affect their mamas and aunties and, you know, family members, because you have set the foundation that these are important and we need to care for each other and our family. We need to do this work. So, you know, sometimes when my mom was like, we got to do it, whether we like it or not, you know, it's going to be a hard fight. It's going to be a lot of work, but it's important because we have to do this for us. So that confidence is instilled. You know, we talk about the importance of that 0 to 3 age group, and everything that can happen during that time, not only for baby, but also for mom and family. You know, that is a very impressionable time. So, you know, that Kibra was saying, planning and being aware of the type of parent you want to be and the type of things that you want to instill in your children even before they come here is like, that's the greatest gift we could give to our children. And that's something that our ancestors want us to do, like you mentioned, Mama. So yeah, here we go.
Wow, nice. Thank you, sis. Thank you for adding to that. That's amazing. You know, and that brought me to, you know, just a few things that we also go through that, because I understand Danielle, I think she mentioned that she didn't want her to see the negative things that she was going through. And I understand that for sure. But then I would also like for us to consider possibly if our children are going through, you know, negative, whatever struggle or some difficult time, you know, how to process that difficult time and how to get through it. And not necessarily that they have to see step by step and, you know, in our own adversities, but at least being able to, you know, at least see that, okay, well, I know that wasn't good. Okay, well, okay, this is how my mom responded. Okay, so this is how you're supposed to respond when something that's not good. You know what I mean? So kind of, you know, still making sure that we are definitely discerning what they see when it comes to the whatever negative that we're going through, whatever struggles that we have or issues, adversities that we face, but also knowing that one day they're going to have their own adversities, you know, so we're making sure that we're preparing them to go out there and be able to have access to the resources and tools. You know, since we're obviously talking about Black Maternal Health Week, when they're having their children and, you know, what they're going through their birthing experience or their pregnancy. Because I've noticed a lot with moms, you know, we go through this phase of super excitement, and obviously, you know, having a baby is very exciting. But and this is for me, this was my experience with my daughter. That was my first child. So, you know, I felt like after I had my daughter and after I researched everything, I need to be getting a PhD. Somebody needs to be putting a PhD in my house, you know, on my wall, my degree. But no, and I'm just saying that because I did a lot of research, because I wanted to make sure that, okay, I know that I want to have this baby at home. I know I don't want to go to the hospital. So the organization or the company that I worked with, I did have a midwife scheduled originally, but I manifested not having a midwife. So they showed up an hour late. Now, my mom didn't know my manifestation, so she was a little mad, but I was happy. So that was what matters. And then everything worked out. You know, I didn't have any tears. It wasn't painful. It wasn't a painful birth. But my point was that in the beginning, I made sure I put in that time, I put in that effort, I put in that work so that I can get the result that I was looking for, which was to have a successful home birth. And, you know, that confidence, even just starting at that confidence, you know, right there at birth, or even before birth, when I was pregnant with my daughter, I was looking for different seminars and workshops and conferences that reflected how I wanted my daughter to be educated. And so I was able to find a few things that I think, you know, we're in Atlanta, and I would go to Atlanta. I went to Atlanta. I was pregnant. I had my mom, my dad, and at the time, my ex-husband and my brother. I'm like, look, this is how you all's child, and this is how the village is going to raise my child. So let's go to this seminar, let's go to this conference together so that we can learn together how this is going to go. And that conference was Liberated Minds Expo with Queen Thais. And what she does is she speaks from a Pan-African perspective on raising Black children, as well as homeschooling them, and just the whole nine, going from health to education, to spirituality, to culture. And so that was very important for me. And I was able to get that even before my daughter got here, because I wanted to just soak as much information as I could, like our children are doing now, so that I could prepare myself to teach. So, it's definitely something that's needed to be happening in the community with our other mothers. And I'm glad we're able to be here to speak on that tonight. So did anybody else have anything from the audience, from the participants? Anybody have anything they wanted to say? Who do we have here? Vivian, Miss Vivian. Who am I speaking to? Hi, how are you? Is it okay for you to hold your camera on? Or who else do we have?
I'm driving. How are you all doing tonight? This is a wonderful conversation. I feel like I can't help as much or participate as much. Unfortunately, none of my children survived. But as I've become older, I certainly, when I was younger, I was often that go-to person for information. And as a nurse, of course, I still find that people are coming to me. I recently became a godmother. And so I find that my goddaughter's mom is often she'll call me if her baby has a rash or things of that nature. So I'm still able to participate and offer those mothering type skills, but not in a direct, immediate way. And also, of course, when I work with kids, whether it's, in church or, with my godchildren, just doing those things like, sitting on the ground and playing with them and doing the things that a lot of adults don't actually get down at kids level. So those are some of the ways where I see that I'm still able to certainly bring the message. And of course, like the rest of you guys, a big advocate for pregnant women, all pregnant women, certainly Black women, because of the data, which we haven't been able to fix. And I'm continually surprised after, I don't know, it's been like 17 years between Pinellas and Tallahassee, and just with that whole idea of better interconceptional and preconception and then post-conception care. And I'm sharing with a colleague of mine at work. So I still work for the state, but I also work at Capital Regional on the weekends. And I was one of our nurses. I didn't even realize she was really embarrassed. I didn't recognize it. But she recently had her baby. She came back to work. Right at 4 weeks, she's breastfeeding. I encouraged her, asked for pictures, did all that good stuff. But when I was telling my colleagues about it related to Black babies and moms and, the early deliveries and the losses, they were surprised. So I clicked on the web and I showed them some of the data. And so all this time trying to get this message out. So I'm really glad that there are still, and these are healthcare providers, of the disparity. And then that also opened up the conversation of kind of like the unspoken when you're in labor and delivery, because one of the ladies delivery and they said, how we are treated is different, not just in labor and delivery, but coming through the ED. I work in mental health, so I see that in the mental health field. This perception, I don't know what the perception is. I don't know why we would think being pregnant and giving birth is different for a Black mom than it is for someone else, but somehow the health provider reacts and treats you is different. And when I was sharing this information, I saw lights of come on, and that was for both people. And I said, we really have to pay attention to how we talk to our patients and from a perspective versus asking them what they want. I mean, birth plans, everybody should know about that. And we should be asking people what their birth plan is. But the truth is, as soon as you hit the hospital as nurses, we're kind of like, this is what we're going to do, and this is how we're going to do it. It's like the mom doesn't get it. She won. And I have not much else to say.
No, you're fine, Ms. Vivian. I think we lost you toward the end, but
oh, I'm sorry.
No,
okay.
You're fine. We definitely got the bulk of what you were saying, and we really appreciate you for sharing that. And just a moment of silence for the ones that you lost.
Thank you.
And I wanted to move on to the next person. I'm going to call on, let's see, ABMD. Hi, are you ready? Are you camera ready or audio ready?
Greetings, how y'all doing? This is Dr. B. Love and respect mothers. I really appreciate you all carving out the time. I resonate a lot with what has been said already. Although not a mother, the way that I see myself as a father is comprehensive. It is one that looks for the best of what we have done in our past, present, and what we look to do in the future. This is what I want to cultivate within my family. I definitely resonated with the activism, saying that being a Black mother is like being an activist. I think we are not explicit enough to really tailor our experiences to the Black family because it is an experience. It's not like other experiences that you may have in the scope of human experiences, but especially when you are quote unquote experiencing life as a so-called Black person in America or in the Western world. Your experience comes with many things that lead to the disparities that we see in the statistics, and the personal experiences that we have, the qualitative experience that we live is should be more validated than any quantitative numbers or what you might find in research, et cetera, because you know and feel what it is to be quote unquote Black because the world tells you and shares with you what that is. And so you have to define it for yourself. And as a father, as a man that is here to be a father and complement to my family, I know that it's paramount for me to be realistic with what the current reality is and share with my family. That means my children, my partners, anyone whom is in that circle of support, the things that I'm dealing with as a man, and also what I am projecting and wanting for my family. I've definitely seen a lot of, speaking for the brothers and for the fathers, I've definitely seen that there is more times than not a reservedness in communicating emotions and or like the reality of what they're experiencing. And it comes from one, a lack of not really having practice in expressing yourself or sharing, as well as two, a fear of how it's going to be received. And I know that the more that we have communities, and especially communities starting from the family space, the more that we have strong relationships between Black men and Black women to uplift each other and to put each other in positions where we can feel safe to partner, collaborate, and communicate, is going to lead to the resolution of these disparities. Because when you have strong parents in position, you can do your best to abate them. It's not going to be completely resolved until we get to the state of implementation on a government scale or on a national scale, when we're talking about really curbing some of those systematic and systemic issues that continue to plague the Black community. So I definitely appreciate you all holding space, first and foremost for each other, and know that I'm doing my best to work for and with the brothers so that when we link up in a complementary fashion, we can definitely affect change in its greatest form. So Hotep to the family.
Thank you, Hotep. Thank you so much. And you, did you say, was it Atum? Is that who?
Yes, this is Atum Boukman, Dr. B, Adam Batista, and B. I work at FSU in the Center of Behavioral Health Integration, as well as I'm a self-proprietor of Balancing Being, where I'm the Chief Wellness Consultant.
Yes, yes. Let us know who you are, brother. Thank you so much for joining us. As we all know that, you know, with the Black family, you know, it is we need our Black men as well. So thank you so much for joining us. I really appreciate that. Wow. I wanted to piggyback off of something Dr. Mandela shared in the chat, and we were. Here we are. Oh, it says that, did I lose it again? Okay, hold on, y'all. Y'all see it, don't you? Where is it? Oh, 67%. I don't see it right now, but I remember it. It said 67% of the OB, the providers, have a bias toward Black women. And 67%, y'all. I mean, you might as well say everybody. You know, that's a pretty high number. That's pretty high number. And so it's like, well, what will it look like for us to have a roundtable discussion where we are inviting providers in so that we can speak on why the bias exists, you know, and then and also making sure that we're getting providers that are not just going to you know, kind of skip to my loo with the question, but really help us to understand, enter, and overstand why it's necessary for this meeting to happen, this town hall, this roundtable to happen, because we have to decrease that. There's no way that 67% can stay as it is or increase over the years when there are organizations like us, you know, that exist. And that's why we have to you know, just kind of make sure we're reaching out and having lots of community outreach with other organizations, because, you know, there is strength in numbers. And when we have Black moms on the table as, you know, as the victim, it's one of those things where we just have to take a pause. You know, we have to take a pause and we have to really ask ourselves, what is it going to take for this difference? And, you know, like someone in the chat said, you know, we have lots of work. We have a lot more work to do. We have a lot more work to do. And it's not going to get done with us, you know, with these challenges that we create where, you know, well, I'm not sure, I don't know, or, you know, communication barriers. You know, we have to just, we gotta speak straight. We have to speak straight, because it's been enough going on when it comes to, you know, indirects and, you know, things that, you know, well, we don't know, or I'm not sure, or, you know, we have to be certain, we have to speak straight, and we have to get to the solution. And having roundtables like this is going to allow for us to get to that solution, as well as being able to see, hey, here's a partner that I can work with that has that like mind, that's going to help us to and support the community objective, which is Black maternal health and just decreasing the disparities. So at this time, we wanted to speak to any of our community partners. If anyone had any suggestions on who they'd like to see us working with, or if you had an organization that you would like to bring forth and have us work with, whether that's Capital Healthy Start and 3 or us both, definitely hit it in the chat or let us know on your audio. And if not, I wanted to go forward because we're almost out of here, guys. We have 5 more minutes. This has been really good. Anything like this is really good to just have to sit down and have a conversation, because that's what it starts with. It starts with that conversation. And as I was saying earlier, with Melanin Mothers Me, we provide different trainings, coaching and consulting, as well as seminars. We offer different services. So, something as simple as, maybe if a mom wanted to learn how to baby wrap, so we could assist the mother with, learning how to baby wrap. Or if there is a mom or, a student or a volunteer who wanted to learn how to help care for a mom in her postpartum care, then, she could join and learn how to do that as well. So Danielle, did you want to go ahead and close with the, I think you have some more information about Captain Healthy Start and Sister Friends Project, and then I'll go ahead and close after that.
Okay, yeah, I just have a few things I wanted to say, and I also wanted to touch bases on 2 comments that was in the chat. And I think one of them was from Daikebra. She's talking about navigating the healthcare system is challenging, but it's important. And also Melanie put in there, the most neglected person in America is a Black woman. And I also agree. So we have the Sister Friends program, the initiative, we have those volunteers there to help our African-American mothers. They're there to help them navigate that healthcare system. They're going to also help them navigate, with talking with the providers if they need, if a little sister can't talk to her provider, if she's afraid, that sister friend is there to be an advocate for her as well. And I agree with you when you said that with the 67%, we need more providers. We need these providers on these roundtable discussions. And maybe it's not just African-American providers. We need the providers that's a part of that 67% so that we can see change.
Yes, I agree with that. Oh, go ahead.
I'm sorry. I just wanted to say that is a fact, Danielle. We need to have more collaborative spaces, more integrated spaces for discussion. It does make an impact when everybody that's involved in that system of care is at the same table hearing the same messages. Mm-hmm. However, that's difficult, so there's a lot of work to do. As I mentioned, Dr. B and I work on the Florida BH Impact program, where we're educating OB providers on these equity issues and the disparities that are plaguing communities and what they can do to start to address that within their own practices and their system. So, we got to work on all sides of this coin, and do our parts.
So Dr. Amanda, what is it that, is it even realistic to say that, maybe in the future, M3 and Captain Healthy Start could put together another roundtable with providers, maybe that you speak with? Is that something, do you think is realistic that they would come to, or will we need some type of incentive, or doesn't look very promising?
Sandy and Chris, though, this is like pulling teeth. I mean, one thing I've learned, and Sandy and Chris probably know, you have to kind of identify that champion, the person or that doctor who is already displayed a vested interest, and use them as your advocate, as your springboard. So
they would be more willing to come. So then we would get them, and then that sounds like it could lead to something really good. Yeah.
I would say also meet them where they at. Like, you want to, if they already have something that they're regularly scheduled for, or mandatory meeting, like find a way to get into that position where they're already going to be in position for you. For us, right? I think that it's not outside of our capability to rally around and position ourselves to make sure that we continue to educate providers in what it means to be an unbiased person, or a person aware of your biases, so that you can actually help somebody get the care that they need, the resources that they need. Because even if you operate with a certain bias, you can still be empathetic and get somebody to somebody else who can benefit them, right? And you knowing that about yourself is a major deal. And so that's the type of work that Dr. Shabaka-Haynes and I do. So I do feel like
I love that. That's amazing, because that's really what it's all about. I mean, we're all going to have biases. We're all going to have differences. We all have prejudice. We're all specific to certain things. And it's unfortunate that, you know, that exists even, you know, with skin color, but it does, you know, it does. So, Dr. B, do you have a more layman's terms way in how we could structure you know, something like this, or how we would gain access to meeting, I guess meeting the doctors where they are, or the providers where they are? You know, what would that look like? Would that, you know, what would that look like?
Yeah, so one thing that I think about is like, there are sometimes there are rounds that doctors do if you're in a hospital setting. Sometimes there are team meetings that they have regularly throughout the month or quarterly. So getting into those positions is what I'm thinking about. And it would look like really what
Uh-oh, Dr. B, you went out. Are you there? Oh no, looks like we lost Dr. B.
Yeah. What it was, I just arrived to my home space, so I think I was switching over the internet. So what I was saying is basically it should look like what it is that we want it to look like. I don't feel like we have to do too much tailoring outside of ourselves, but the main thing is we want to inspire that empathy and awareness, right? So it might be a conversation, it might be testimonials that are shared, it might be presentation, whatever the format is, I'm not exactly sure, but I do know that there are these regularly scheduled meetings that physicians, clinicians, and all sorts, whether they're at any level, are going to have reoccurring team meetings. So when we get into those pockets and into those circles, just finding out who's managing the team to get into those pockets and into those circles. And so that's what that's what I think about.
Okay, I got you. Because I'm just like, okay, well, you know, I mean, everybody's not like me, but, you know, in my mind, when I hear Dr. B say that, I'm like, okay, well, I'm going to roll myself up here in this hospital, and I'm going to show up at one of the meetings. I'm like, hey, listen, y'all didn't listen to me. I know that obviously that can't, you know, happen. That's not realistic, right? They'll probably.
Well, best is a combination, like Dr. Shabaka-Haynes had mentioned, is identifying those champions. So anytime that you're quote unquote ushered in, or you got somebody, because in those pockets of medical professionals, it's about who you know. It's a good old boys
that's
club.
what I was going to ask next.
This is why we deal with these types of disparities, because historically it's a good old boys club. It is what it is. And so the more that you have somebody who's going to quote unquote co-sign you or usher you in and put you in the right position, and then you do what you do after that. So we can definitely identify and look for the best times to do so. But I know the work that Dr. Shabaka-Haynes and I do, we can identify a few of those pockets and a few of those circles to start that process.
Okay, gotcha. Yeah, I know that at the end of this month, at the end of this month, Tallahassee Memorial Hospital did reach out to me to facilitate a few meetings that they're going to have. I think it's the Baby and Family Fair virtual speaker series. And so I'm going to be speaking on facilitating two panels there. So I'm thinking that I'd probably go ahead and shoot my shot to see how I could get in. And if anybody had any professional advice on, just how to connect in that realm, because Tallahassee Memorial Hospital obviously is its own entity. So I want to make sure that, my ducks are in a row and I'm going about it the right way, so that I could get to the result, because the result is we need these healthcare providers to understand, to know, that, you know, we need to knock these biases out so that we can get the proper help that we need. That's just what it is. So thank you so much, Dr. B, for reiterating and speaking. Thank you for everyone who spoke. We're going to go ahead and close out. I wanted to thank you all so much for joining us at our first annual, right, Chris? Our first annual Black Maternal Health Week Roundtable. Thank you all so much for joining us. We are so excited. Melanin Mothers Meet. Again, we are having more events this week. Our next event, actually, we have Nadia Francis on. She's going to be doing a Zoom online conference about reclaiming the body. You know, because it's very important for us to understand that, you know, after we have babies or after we go through different adversities, we have to bring ourselves back to center. And she's going to help us with that on Thursday from 8 to 9. And if you're interested in that, it will be, or it's already on the website, www.melaninmothersmeet.com. And Nadia, I'm not sure if you were in a position to speak on that at all. If you'd like to, if not, that's fine. I don't know. Okay, I'm gonna keep going.
By the way, I did post your website as and a link to the events on our FloridaMomsMatter.org webpage. So that's a way that we do try to support the mothers and the women, men, and children that are doing the work in our space.
Yes, Dr. B, I appreciate that. I shade to that. Welcome. Okay, awesome. That's awesome. Thank you so much for that information. And I just wanted to say that after the event Thursday, we have another talk show on Friday. We're going to be on Conversations with Nicole. If you all are familiar with Miss Nicole Everett, she's going to have myself and Sister Shantae, and we're going to be speaking about Black Maternal Health Week as well. So check us out on www.melaninmothersmeet.com. Danielle, did you want to go ahead and say anything? Are you good? I didn't know if anybody else had anything to say.
Oh, yes. I want to let you guys know that we are currently recruiting sister friends and also little sisters. And we're looking for community members to join our access to our work groups.
Yay!
Yeah,
awesome.
And again, they can reach out to our executive director, Chris Sorchik, and her email is chris@capitalareahealthystart.org. Chris, if you want to put your email in the chat, that would be great.
Yay, Chris is awesome. Thank you all so much. Miss Sandy, Nadia, I see everybody. Nana, thank you all so much for being here. Alexis, hey sis. It's so good to see you all. Well, sort of, but it's so good to see you all. And I really appreciate you all for, you know, just showing up, because that's half the battle. You know, you got to show up. Obviously, we're all momming, so we know that, you know, that's a lot. That's a lot of what's going on behind the scenes, but you're still here. You still made time, and that says a lot, you know, and I really appreciate that. Danielle appreciates that. All of our organizations, Sister Friend Project, these are dynamic things, and we're going to do great things. This is really, I mean, you know, we can say this is just the beginning, but it really is just the beginning, because 67% is lots. That's just too much. So we got to bring that down. So clearly this is just the beginning. So within this beginning, we have, you know, people who care and who love and support and advocate, and that's where it starts. So I really appreciate you all for joining us tonight. We are 8 minutes over time, 9 minutes now. So we're going to go ahead and close. Again, thank you, Chris. Oh my goodness. Thank you so much. Chris has done a lot of background help with me. She helps me to debrief and to release and to relax. So I really appreciate Chris for having that tactic within her. And Melanie, I really appreciate you for bringing that that knowledge to the advocacy and policy. And I'm so excited to see the work that you're going to be doing for M3 and for the community, because it is very important. Thank you all to everyone else who came on. Dr. Mandela, Daikebra spoke. I think of Sister Rose, Dr. B, Miss Vivian. And thank you all so much for just being a part. And Danielle, we did it, girl. So I appreciate you all, Nadia, and we will see you all next time. Again, we will have a survey. Chris will send out a survey to everyone. So please look out for that and please fill it out. Okay. Thank you all so much and look forward to seeing you all soon. Bye.